If you're trying to learn a new computer program, the first step is to become familiar with the interface. The interface is the working environment, the opening screen, so to speak, the place where you make things happen. Learning an interface is oftentimes the hardest part of mastering a program and can sometimes feel a bit overwhelming. In blepharoplasty, the interface is the eyelid, and the eyelid is nothing if not its anatomy, that is to say, its component parts. If a surgeon doesn't understand the anatomy, he or she is going to have a tough time pulling off the operation. If a patient doesn't understand at least the basics of the anatomy, he or she won't be able to understand what's possible and various options beyond the fact that blepharoplasty is a very cool operation that's designed to make a person look better. So, let's spend a little time with the eyelid's interface to learn what there is to work with. That way, in the later movies, we can discuss options for achieving different outcomes or correcting problems and so on and so forth. The opening screen, if you will, is right there on the surface, namely the skin and its various contours and landmarks. Highest up is the eyebrow, which is a fact that you already understood, and so that gets us off to a comfortable start. Next down is the upper eyelid. I know that sounds rather self-evident, but you'd be surprised by the number of people who think this structure is simply called the eyelid, which means that this part down here is who knows. So let's set that straight. This is the upper eyelid, and this is the lower eyelid. Actually, the two are mirror images of each other, but clearly there are subtle differences in the way the layers interact with each other, and particularly with the way they interact with gravity, and these differences are important, as we'll see in later movies. Okay, so this is the upper eyelid, and in most people it's divided roughly into two parts by a line called the crease, shown here. There's more to the crease than just that, but for now the word crease is sufficient, and we'll talk more about the subtleties of the crease when we get into the movies dealing with Asian double eyelid surgery. This area, just above the eyelashes, is known as the platform, although this isn't a formal medical term. Still, it's a convenient way of talking about that part of the eyelid sitting below the crease. Then we come to the eyelashes, and then of course we come to the eyelid's edge, or eyelid margin, as it's called. Both the upper and lower eyelids have margins, and it's the space between them that shows off the eye. Now for a term that you may not be so familiar with, canthus. The canthus is not really a structure, but more of a region. There is an inner canthus, or medial canthus, and a lateral canthus, or outer canthus. The lateral canthus is a very important structure when it comes to lower eyelid surgery, and so we'll be talking a lot about the canthus in some of the movies to follow. Now, let's jump to the next screen on the interface. To do that, we have to go below the skin, where one finds a big and more or less circular muscle. The formal name is the orbicularis oculi muscle. This is the eyelid's closing muscle. It doesn't open the eyelids, but rather allows them to shut. It's also important because it helps to hold the eyelid into proper position against the eyeball. From here on, things get a little more complicated, but also a lot more interesting. If we strip away the orbicularis muscle, we come to a new layer that probably doesn't look very familiar. Put simply, this is the supporting or structural layer of the eyelid, and it's very, very important in pulling off a safe blepharoplasty, especially during surgery on the lower eyelid. The support system consists basically of two main parts: the tarsus, sometimes called the tarsal plate, and the canthal tendons. The tarsal plate gives shape to the eyelid, which by now I think you realize is far more than just a piece of skin. The tarsal plate has the consistency of a thin piece of cartilage that's connected to the rim of bone surrounding the eye by two tendons, the medial canthal tendon, and the lateral canthal tendon. The bone is called the orbital bone, and its very edge is called the orbital rim. So tarsal plate, canthal tendons, orbital bone. The milky white layer that attaches to the tarsal plate and connects to the orbital rim all around is known as the orbital septum. The orbital septum doesn't do very much. It doesn't contract, it doesn't move, but it's very important in eyelid surgery as both a structure and a landmark, and we'll get into that more in later movies. There's another interesting thing to know about the orbital septum. It marks the formal end of the eyelid and the beginning of the orbit, which is the space filling up the socket and the very same space that holds the eyeball. There are other structures that come into and are part of the eyelid, but they're hard to show from a front view. So what I'd like to do now is change our perspective and take a look from the side. Pretend we sliced the eyelid down the middle and turned it sideways to examine it in cross-section. Okay, so here's the skin, and here's the muscle, and here's the orbital septum. In the lower lid, a similar situation: skin, muscle, orbital septum. This is the edge of the bone, or the bone, and with the bony rim above the eye. This is the bone below the eye. The very back lining of the eyelid, which has not been shown previously, is shown here in green, and it's called the conjunctiva. The conjunctiva lines the eyelid and then flips onto the eyeball surface, and one can see it over the white of the eye. In fact, that's why an eyeball can sometimes appear blistery or even bruised after blepharoplasty. It's because the two structures share a common layer. The other parts that you see here are really not eyelid structures per se, but rather come forward from the orbital cavity and into the lid. Nevertheless, they are important in blepharoplasty. The most obvious structure, and the one just in back of the orbital septum, is the orbital fat. Okay. This is the same fat that can bulge forward in some people and cause eyelid bags, or in other people disappear with aging or after excessive surgery and result in hollowed-looking eyelids. This fat extends deep into the socket and all around the eyeball where it cushions the eye from the bone. So the front part of the fat that we see from the eyelids is really more like the tip of an iceberg. From the front, the fat often seems to be divided into two pockets or bulges in the upper eyelid, and they're called the nasal or medial pocket and the middle or central pocket. In the lower lids, the fat often appears as three pockets: the nasal, middle, and temporal, although sometimes they all come together to form one big glob. Fat is one of the most important tissues in blepharoplasty, and yet here's the rub. Except in minuscule amounts, the eyelid really doesn't have any fat of its own, which makes the eyelid skin very different from any other skin in the body. What we often refer to as eyelid fat is actually orbital fat. Is this important to know? Yes, it is, and we'll talk more about it in future movies. So let's head back to a previous picture, the one showing the support system and the orbital septum, and then strip them away to view what's underneath. What's underneath, which you already know, is the orbit, or the space around the eye, which is the area within the bony socket and the same area that the eyeball calls home. The orbit is also home to a number of other structures crucial to vision and somewhat important to blepharoplasty as well. Perhaps the most important structure besides the fat is the levator muscle complex. The levator muscle begins in back of the eye and then comes forward over the top and turns into a tendon as it enters the eyelid. The formal name for the tendon is the levator aponeurosus, although if you just remember that the levator consists of two parts, the muscle and its tendon, you'll know as much as you need to know and probably more than you want to. Other structures shown here are the tear gland, which makes tears when we cry, and the tear duct, which drains them away, and one of the 6 muscles that helps to move the eyeball rather than the eyelid. What's most important to reiterate about this last slide is this. What we often call eyelid fat is not part of the eyelid. It's part of the orbit, and so is more correctly called the orbital fat. And why is this important? It's important because it means that blepharoplasty is not really just an eyelid operation. It's an operation on the eyelid and on the orbit. Understanding all of this makes the operation seem a little more scary than it did when you thought of blepharoplasty as a simple surgery on a tiny piece of skin. Okay, now that will do it for the interface. In future movies, we'll go into what can be accomplished by working within this anatomical environment, including what can go wrong if one doesn't extend due respect to all of these various layers and structures. There's much more to come on anatomy in future movies, but only in little pieces that are appropriate for the topic under consideration. That's it for the overview. I hope you're still awake and with me.